Saturday right now, and the 7th, no, the 18th. I'm getting my days mixed up. So I have exactly 2 days before I have surgery. The surgery is a laparoscopy that is meant to go in and check for endometriosis. So before I have the surgery, thank you Daisy, that's the floof of my life. This is Daisy, just so you know. You're gonna see her a lot, I promise you. Endometriosis is essentially the disease that affects the reproductive system, specifically the uterus and the area outside the uterus. So I'm going to kind of, excuse me Daisy, I have a visual aid. Meet my angry uterus. This is actually a heating pad that I got from one of the women that is part of the endo group that I'm in on Facebook, and I just loved it so much, so I just kind of throw this into microwave, heat it up, stick it right there wherever it's hurting. Anyway, so the uterus has like the lining along the sides that you know, thickens every single month when the egg drops from the ovaries, comes down through. If the egg gets fertilized, obviously, then it will stick to the lining and will then grow a baby. This lining area is like the endometrial lining, and so what happens in endometriosis is that this tissue that is kind of the endometrial lining, it will go from inside the uterus where it's supposed to be, and this tissue, or this endometrial-like tissue, will actually get outside the uterus. And so where all of the other organs are, this tissue will get out into it outside of the uterus here, and it will attach into other areas of the body. It can attach onto the bowels, it can attach onto the spleen, the liver, it can attach onto, for some women it's attached onto it can go as high as the lungs. It can attach onto like areas around the ribs. There are women who, the ones that when it attaches onto the lungs, a lot of women end up, during their period, they end up coughing up blood. And the problem with this, when this endometrial lining or these endometrial-like tissues end up outside of the uterus, when it attaches onto other places, is what happens is when things like ovulation happen, or when the lining in there is shedding. So when ovulation happens and it sends out the hormones that then tell the endometrial area to thicken, it does it, the ones that are outside and that are attached to other areas of the body, that are attached to like the spleen, the bowels, things like that, that thickens too. It does the exact same thing that the endometrial lining does inside here, but it's doing it out where it's not supposed to be. So this comes with all sorts of different types of symptoms. It can come with extreme pain, which is one of the ones that I have. I have like really extreme pain down in my abdomen, particularly right around here. it's in the cervix and upwards is where it's like really bad. Some women have really severe diarrhea during it. Heavy bleeding is a really common issue, and I do have that. There are women who can go through, like, some of them can go through a really heavy pad in an hour. Before I started using the cloth pads that I'm using now, I actually, when I would get up in the morning, like, I would have like gush moments, and it would end up leaking and going all down my leg, like all over my pants, all over the underwear. Like, I'd have to like change like underwear, pants, like change the pad, throw that in the hamper. I'd have to take a shower or a bath to clean up. I'd have to like get as clean as possible. Pain with intercourse is a common one, and I see that a lot in the endo groups. It's one that I deal with. I was diagnosed with what's called vestibulodynia, and what that means is that the vestibular area, like right in the opening of the vagina, and around the labia, it's painful when something is inserted. So tampons, a penis, things like that. I had a lot of trouble using tampons for a long time, and sex was a no-go. For like my first sexual experience with a boyfriend that I was really serious about was awful. Like, my first time having sex was horrible. It was painful. I spent the entire time just hoping that it would get over really soon. Like, hoping that he would finish really soon. Like, that's all I prayed for. Like, and it took, I don't even know how long. It was a really long time before I ever felt anything good about sex. And like, I had to go and do pelvic floor therapy, which actually involves a physical therapist. Like, they prescribe dilators, which are these like different thickness, like rods essentially, that you use to insert and work on giving better muscle memory, essentially, to help with the pain and make it so that the next time it happens, like, there's not pain. Like, they also like use their fingers to work on the pelvic floor. It's not a pleasant experience. It's not fun. There's pain with bowel movements and urination. I have a lot of that. I have IBS. I've been diagnosed with that for a really long time. Excessive bleeding. Infertility is a big one. A big one. And it's a painful one. There are a lot of women with endometriosis that never get to have children, that really want to, and they can't because of what endometriosis has done to their system, what it's done to their uterus, what it's done to their fallopian tubes and the ovaries. And one of the comorbid illnesses that comes along with it sometimes is PCOS, which is polycystic ovarian syndrome, and you get really like painful cysts on the ovaries, and it can really overtake them when they rupture, essentially. It's awful. I've not gone through that, but one of my best friends does quite often, and they're talking hysterectomy taking everything out, probably, like including the ovaries, because of the cyst that she gets there. And like every single time she gets a cyst there, it's like I just want it to pop already. And I know that when it's gonna pop, I'm going to throw up because it's gonna be so awful. But after that, it's gonna get better. And hearing her talk about things like that, it's like, wow, that's pretty awful. Comes with a load of other symptoms. Fatigue, diarrhea, constipation, bloating, nausea, and all of this tends to be a lot worse during menstruation. And the only way to diagnose endometriosis is through a surgery, a laparoscopic surgery. And that is because you cannot see any of it in scans. You can't see it in ultrasounds, you can't see it in CAT scans, you can't see it in MRIs at all. Like, unless you have an endometrioma that is extremely large, nothing shows up on any sort of scan at all, and there's no sort of like blood test or anything like that. It's not possible. So any doctor that tells you that there is anything other than laparoscopy in order to diagnose endometriosis is talking out their ass, and they don't know what they're talking about. So the surgery that I'm having is a laparoscopy, and what that means is they'll go in probably around like the belly button, and then they'll probably do like 2 to 4, but closer to around 3 different incisions to put the instruments in. And what she's looking for is this endometriosis throughout the abdomen, and she'll look in the uterus, but she'll look all around the uterus as well. And what will happen is, if she finds it, because she is an excision specialist, she is specialized in endometriosis, she knows this very well. She will go in while she's there and she will excise all of the endometriosis that she can find. So she essentially like will take it and take it out. And if she doesn't find anything, she will go and she will take a couple of biopsies inside the uterus, because sometimes even when you can't find anything, there are microscopic things inside the endometrial lining that is endometriosis, but you have to take biopsies to look. And then the other thing she's going to do while she's in there is she's going to inject like dye into the tubes to make sure that there's no blockages, because we've been trying for a second. It took us like over a year and a half to have our first, and it was hard. We're having just as much trouble, if not more, this time, because like I've been trying to keep track of the ovulation, and I think it only showed me the ovulation once. And in all of the many months that I've been tracking ovulation, like taking these ovulation tests over and over and over, it's been showing nothing. No ovulation at all in months. And I'm still getting my period, so something has to be happening, but it's really frustrating. Originally, when it was first, I first had it happening, it was like, oh, well, obviously, you ovulated for a total of 5 minutes and you missed that opportunity. Congratulations! But, the longer it went on, like, the more concerned I got and the more frustrated I got, because this isn't going to help me get pregnant. And one of the things she told me too was that generally after this surgery, the fertility tends to be higher for patients. So This is all of that great fun that is going to be happening on Monday. Bright and early, we have to be there at 7:30, which means we have to leave the home here at about 6:30 in the morning, which I'm really looking forward to. Yep, totally. Yeah. Recovery is different for each person. She said the general, like, big recovery is about 2 weeks. But some people have said that it can take like a month to 3 months to really feel normal again. And some people, it comes back. It keeps coming back because unfortunately there's no cure for endo. There isn't. There's no medication, there's no therapy, there's nothing that they can do. There's no treatment that cures it. There's nothing that gets rid of it. Hysterectomy does not cure it, because unfortunately the cells are already outside the uterus, so taking out the uterus might calm down some of it, but for the most part it does nothing. For most women it will do nothing because it's still happening all outside of the uterus. So it's kind of a crapshoot. There are a lot of women that end up having this surgery that I'm going to be having multiple times, and it's a little daunting, but I mean, I don't know, for relief and in this particular instance, just to be able to know what's going on, I think that I would kind of prefer that. Like, that's why I'm doing this. I want to know for sure. Like, there are other people who have talked about, like, you know, they're pretty sure they have endo, but they're not going to do the surgery because, like, they don't want to go through it. And that's fine. For me personally, though, I want to know. I want to know for certain that this is what it is and this is what's going on. Because, and especially if this surgery can help me get pregnant, then I want to do it. And I just thought I would take you guys along with me because unfortunately not enough people understand this disease and not enough people research to understand, and I think the more people speaking out, the better. Well, here we are at the Attribution Center, which is a university hospital's facility, and Dr. Billow, who is a specialist in endometriosis, will be doing the surgery today. So I'm all set up now. I've got my IV in and everything, and we're just kind of waiting now. Like, it's just a matter of waiting for them to come in. I probably have to see the anesthesiologist still, and then after that, like, talk to just talk to the nurses that are taking me in, and then go in, and they'll put me out and get to work. They have it down for like 1.5 hours for the surgery. And as far as if you can see that, but they said that that's just generally, like, you know, putting me out and stuff and waking me up, and, you know, it'll depend on what they find, and what she has to, like, take out and everything. So awesome. So we just got home. We didn't do any filming in the recovery room because I was, like, really out of it, and yeah, I'm still kind of out of it. So they did find endometriosis. She took out a fairly sizable mass behind the uterus. It had not adhered to the bowels yet, but that's where it was trying to head to. I am in quite a lot of pain. And what's funny is that it's not necessarily from the incisions. Most of the pain is from gas, like, it's all in, like, here and up, like, my shoulders, and this whole area is just killing me. I got Gas X, and I've taken one of those now, and I was told about this ahead of time, that, because they put some air in there to kind of, like, be able to see around everything and work, and it causes a lot of, like, air and gas buildup, and it's, like, really painful, and that's kind of where I'm at right now. So I got 3 incisions. We've got, we've got the one in the belly button, which is the main one, and then we've got one to the peripheral side, like over here, and then one over here. So you can kind of see, like, that's the whole thing. It's kind of bloated right now because of the gas and everything, but, like, this is where all of, like, the camera went in, and then our tools went in over on the sides and everything. So I've got stitches inside, and then they have, like, tape on it right now, but there's also, like, some glue that's kind of, like, keeping it all together. And they said that the stitches will just kind of dissolve in there. So yeah, that's fun. God, it hurts so bad. Like, I keep wanting to, like, stretch, but, like, I don't think it's gonna help. Especially, like, right in here, it hurts so bad. So, yeah. I'm gonna go have banana pudding, and then, I'm gonna try to rest for a bit. Bye. Hey there. It is day 2 of the surgery. I woke up not too long ago. It's like 1:52 right now. I didn't get to sleep until later because I was having pain in my shoulder from the gas, and that was causing some issues. I was kind of trying to find the sorry, I'm pain fogged right now. Like, sometimes with pain, you, like, it, when it's bad enough, like, it starts making your brain fog out, and you can't pull the words out because it's so bad, and, like, your brain just kind of starts numbing because it's trying to, like, process everything. That's kind of where I'm at right now. I've been trying to come up with the energy to make a video, and it's taken a bit. So I woke up closer to 1. I needed to get, like, pills in me and the heating pad, and I've got an ice pack on, and I've got a Daisy. She's keeping me company, but she's only keeping me company in a certain way right now because, like, she keeps trying to lay on my stomach, which isn't good. That's not helpful. Yeah. Are you helping Mama? You helping Mama, or do you just like the warmth? Oh, it's grooming time. Okay. She's got to keep all that floofs clean and taken care of. Cover herself in cat spit. So, yeah. I woke up today in a lot of pain. Like, I'm not doing well at all. It hurts a lot. It hurts to walk around. It hurts to kind of, like, move my abdomen. all of this, like the shoulder pain and the chest pain, is from the air and gas that they put in to in order to see better. And like they believe, like, because they tilt you with your head down so that it's that helps them get a better view, and so all of that gas kind of like settles down into the chest and shoulders. So that's been pretty bad. And the incisions, the area around the incisions and around my ribs are just killing me right now. Like, it's pretty painful. Like, day 2 is far worse than day 1 was. Far worse. It's really hurting a lot. So, I have a lot of feels right now about being diagnosed. That I'm gonna try to set up the better camera. I have it all over here. I just need to get the energy to set it up. Koi had to go to his doctor, and Seth is over at his aunt's house, because, you know, he's 3, he doesn't always listen, and I just I don't have the ability to keep up with him and do all the things that he needs me to do right now. And there's a lot of feelings there too. It's hard as a mom, as a disabled mom, especially like after a surgery, when you kind of feel like, oh, like I can't do all the normal things in order to take care of him. Like, does that make me less of a mom? Does that make me a bad mom? Does that make me somebody that is he missing out? Is he being hurt by having a mom that can't do all these things, and that he has to see me like this? It's hard. It hits a lot of doubts. And when I'm not like this, when I'm like a lot stronger and I'm doing okay, like logically I'm like, no, he's fine. A lot of kids have disabled moms. I grew up with a disabled mom, and she was amazing and is amazing and one of the strongest people I know. And she's taught me so much. And like, I know that my life wasn't detrimentally impacted by that. If anything, I think it taught me a lot of empathy towards people that are different, a lot of understanding. And so when I started dealing with my own stuff, like, I was more prepared to kind of like enter the disabled community, because I already felt like part of it with my mom being a part of it. But yeah, so when I'm a little bit better able to, I will get the other camera set up and talk about feels. I've been having kind of a tough day, but so this is probably my better angle for this camera right now. I wanted to talk about like some of the statistics of like endometriosis, and like kind of how I'm feeling about like finally being diagnosed with it. Generally, like the general like time range for an endometriosis diagnosis is usually between like 4 years to 7.4 years. And it depends, but like it's what they believe is the actual like general like median time is, or the average time period that a woman kind of waits and fights with doctors in order to get a diagnosis is 7 years. And it depends on the woman, and it depends on the doctors that they go to. And like one of my friends was saying, and she's had endo, she has endo and has had it for a long time, and she was talking about like, you know, it took a long time for her to get diagnosed too, and she said that like, you know, well, yay, you beat the average time, and I don't know, I feel a little conflicted with it because like I really didn't. Like, I'm sure for some people it probably feels like I did, because like in the time of actually talking about the endometriosis, sorry, it's really hurting today. In the time that they like, I actually like thought about it being endometriosis, it's been like, I don't know, like less than a year of really like fighting for it this time. But I have the issue of like, there was a lot that went on before. I had been wondering for a few years whether I might have endometriosis, but I didn't really do much with it because I had given birth to my son, and I was on a birth control that made it so I wasn't really having periods, along with the fact that I was still breastfeeding, so periods weren't a thing that was happening, and I just kind of left it. I had gone, I want to say it was like back in like 2010 or 2011. To my doctor, to my gynecologist, about period pain. And he ordered an ultrasound, and there was nothing on it. And I had been thinking at the time that like, okay, so what's the next thing? What do we do now? And was a little surprised at getting, at just kind of getting the answer of like, well, nothing's there, nothing, you know, we didn't find anything on the ultrasound, so everything with the uterus is fine. So there's nothing to worry about. You should, you know, take some Midol. That should stave it off. You know, you should be fine. And at the time I was so like surprised and upset that it wasn't being taken seriously, which was kind of an again thing, that I didn't fight him about it. And so I left it. I left it alone. And I walked out really discouraged, and I didn't do anything about it. And, you know, that was kind of my life. And when they brought up, you know, doing an ultrasound this time, I was like, alright, but like you guys did that like 7 or 8 years ago. Like not this office, a different office, but like you guys did this 7 or 8 years ago and found nothing there, and I was told, well, it's fine, just, you know, whatever, you'll be fine. And this isn't fine, it's getting worse. Like the pain is getting worse. The issue surrounding this is getting worse. And I'm having a lot more trouble getting pregnant this time than last time. Like, to the point that the ovulation tests aren't even picking up ovulation at all. And like, you know, I was really being told, like, you know, when that negative ultrasound comes up, I need to be like, okay, what's the next course? Because endometriosis can't be found on a scan. It can't be found on an ultrasound, a CT scan, an MRI, blood test, anything like that. So what is the next option? And I even had one of the she was like otherwise a physician assistant, or she was one of the like lower physicians, like, you know, a step down from the regular doctor at the gynecologist's office, be like, well, you know, the ultrasound was clear, so as far as this goes, like, you know, your options are, you know, taking something when the pain comes up, or birth control. And I was like, okay, but we're trying to get pregnant, so that doesn't seem like the right idea. And she was like, well, then the best you can do is, you know, take things like ibuprofen or Tylenol. And I was like, okay, but that's not working right now. Like, this is getting worse, and it's getting significantly worse as time goes on. Like, each new period is more painful, and things are working less and less to help with it. So what am I going to do now? And I told her at the time, I was like, I'm concerned that I have endometriosis. And she was like, well, your ultrasound came back clear. And I was like, right, you can't see this on an ultrasound. And she was like, well, your endometrial lining was fine and clear. And I was like, you can't see this on an ultrasound. And like, it was like talking to a brick wall with this woman, with this physician. And like, and finally she was like, well, I'm just telling you what the doctor is gonna tell you. And then she walked out. And like, I sat there really frustrated, and like, it felt like, again, I wasn't getting any of the help that I was supposed to be getting, that you should expect from your doctor. Like, it's just being blown off again. Like, never mind when a woman has pain or anything like that, because obviously we're just being histrionic, right? Like, you know, we don't really mean it. It's not really that bad. Like, we can just take a Tylenol and it's fine. I was so frustrated, and I just like looked down at my phone, and I messaged our group and I said, I don't know what to do. And then I just started sobbing, because it felt like I was just kind of being like pushed aside again. Like, everything I was going through didn't matter, and they weren't going to do anything for it. They weren't even going to look into it. And luckily, the actual doctor, the actual gynecologist, was like, I definitely believe you about the pain. I don't think that there's nothing going on just because we can't see it. But the only thing we can do from here is to send you for a surgical consult. So, and I was like, yeah, that's what I want, because this is the next step. If we don't do it, I'm never gonna know. And she did that, and then like when I was talking later with Jess, like she was like, no, cancel that one, call Dr. Billow. She's a specialist, she's one of the best doctors I've ever met, and set up the surgical consult with her immediately. And like, I ended up having to wait, I think, 1 or 2 more weeks to see Dr. Billow than I would have with this other surgeon. But I think that going for a surgeon that really truly knows what they're doing and is really experienced and a specialist in endometriosis and excision of it is probably the best option, because there are a lot of doctors that unfortunately will go in to do the laparoscopy and be like, well, there's nothing here, there was nothing there, I didn't see anything. And then when women then take those results and everything and go to an actual specialist, the specialist, all they have to do is look at the pictures from the surgery and be like, but I see endo right here and right here and right here. How did they miss it? As far as the period pain, it's been at least 8 to 9 years. And then on top of that, endometriosis is comorbid with a lot of different things and comes with a lot of symptoms that are tricky to treat. One being pain during sex. And I've had, like, when I was 13, maybe I wasn't quite 13 yet, I think I was 12 at the time, I was on the swim team, and I loved it because I was very much a fish in water and wanted to get as good as I could. And when my period started, Mom was like, okay, well, we have to figure something out because you can't just sit out during, you know, your period. So she was going to show me how to use a tampon, and I was trying and it was painful. I couldn't figure it out, and Mom decided that she was gonna like try to show me the actual, like, the right way to do it. And when she pushed in, I screamed and ran. Like, I jumped up and then I ran into my room and hid under my bed. And she came in like after a few minutes and was like, I didn't realize it was that painful. Like, I'm so sorry. And we went to a doctor at the time, we went to a gynecologist, and her reaction was like, well, she's too young to be wearing tampons anyway, so I don't see what the problem here is. And I've had a lot of people over time, like when I've talked about this story, say, well, that's true, but here's the thing. There were a lot of other girls during that time who were on the swim team, my age too, who were using them and were capable of using them. And it was a necessary factor in being part of the swim team. You can't just miss a swim meet because you're on your period. It's not really how it works. I ended up having to quit the swim team because of this. I mean, I've known about that issue since I was 12. And I'm 32 going on 33 this year. In December I'll be 33. So like, we're looking at essentially like 20 years that this has been ignored. That I've likely had endometriosis. That I have had endometriosis and it's been ignored. That's awful and hurting. It hurts. It's really hurtful. I'm angry. I'm really angry and upset and hurt. I feel like I put my trust in these doctors to have my best interests at heart, to care about their patients, and they've let me down at every turn. And it's not all of them, but the ones that were supposed to have had some knowledge in this, all of them did. Until now. Until I pushed for it, until I learned about it and pushed for it and demanded it. And if I hadn't known that endometriosis couldn't be found on a scan, what would my gynecologist now have done? Like, it makes me wonder. She was taking it seriously, but I don't know, would she have offered that surgical consult if I was being so stubborn about it? Or would I just have fallen through the cracks again? That's pretty awful. No person who has this disease deserves to go through the what ifs and the not knowing and the doctors that make you question your sanity about it. It's really wrong. Like, at the least, I should have known about this in high school. And I don't have a good outlet for that anger and hurt. There's no specific area to direct it at this point, because all these doctors, like, I'm not in contact with them or anything. So what do you do with it? What do you do with the anger and hurt and resentment that's just kind of like bubbling in there while you're laying here, like, unable to do much because you're in so much pain? I don't know. My heart tells me I should creatively get it out. And that's probably what I'll have to do, because I don't have a lot of other options. There's no telling someone off or saying, you didn't help me with this. Why didn't you help me with this? And even if I could, I don't know that the answers would give me much relief. So I just have to focus on what's in front of me and on recovering from the surgery and healing my heart from all of this in the best way I can. I don't know.